All right. Hello, everyone. Good morning. Good morning. Apologies for the delay. My name is Christopher Burnett. I am the chair of the council's health committee. Pull the list. There we go. Still not out of the weeds here. My computer's acting weird this morning. Sorry about that. This is the December 1st, 2020 hearing for the health committee. Before we get started, a few housekeeping items. Please make sure that you mute yourself when you're not speaking. Identify yourself before you speak, so we have it for the record. Make sure that you speak slowly and clearly. And after you are finished speaking, please remember to mute yourself again, so that we can make sure everyone is heard clearly. And this is going to be broadcasted on Charm TV. We are joined today by, pull the list, there we go. Okay, so we have Councilmember Henry, member of the committee. A number of council members reached out to me this morning. They're going to be delayed, but we will be joined later by a few others. We also, I see staff from the health department, the council president's office, and the mayor's office. And any tech questions, please direct them to our amazing committee staffer, Marguerite Curran, who's going to help us run the show today. Make sure we're all on point. Let's see. All right. So we're here today to hear from representatives from the city's health department, who are going to provide us an update on the department's seasonal flu vaccination plan, which will include data on current citywide flu vaccinations. I do not see the council president here, so we will get started this morning with a presentation from the Baltimore City Health Department. Margarita, are we good on screen sharing and everything? I did overhear that while I was trying to get my camera to work.
Yes, Mr. Chair.
Okay. All right. I will hand it over to the BHCD Health Department. I'm not sure.
Thank you.
Sorry, I don't have the list. I'm sorry. Otherwise, I'd say this person's out. My bad.
Thank you so much, Councilman Barnett. And we are very excited to be here. My name is Rebecca Deneen. I'm the Assistant Commissioner for Maternal and Child Health, and I'm here with my colleagues, Hyung Tan, who's the Deputy Commissioner for Aging and Care Services, and Dr. Nolan O'Dowd, who's a prevention medicine resident working with us on the flu strategy. And I think Dr. O'Dowd will be sharing the slides shortly. Nolan, are you good?
Hi there. Yeah, it's Nolan. I am still having issues with the permissions. I know I saw that Marguerite made me the presenter, but I still seem unable to share my screen.
Yeah, I don't have sharing content either.
Marguerite, are you able to grant those? I'm not saying it on mine either. It's just kind of strange.
I can switch it over to Rebecca, but right now Nolan has the capability to share his screen. I don't know what the problem is. Rebecca, do you have the same material that he has?
I do. Yep, I absolutely do, and I can completely share it. Yep.
Well, let me switch it. Let me switch it. Let me see.
Sure.
Okay, see if you can bring your information up, Rebecca.
Is it share? Are you guys seeing anything?
No. Oh, here we go. It's coming.
Sorry, hang on. Let me try it again.
I can see it.
You can see it?
Flu vaccine strategy, Baltimore City Health Department, City Council.
All right, let me put it into slides. There we go. Okay, so Great. I'm going to talk to you about the flu vaccine strategy, just trying to sort out the technology here, that we've had going on since late August. So first of all, we brought together, this has really been a population health approach to flu vaccine this year. And so we brought together a number of stakeholders, including residents and providers. And we want them as a vision to understand the value of flu immunization, and particularly the most vulnerable become vaccinated against influenza during the 2021 season. I will say that we really hope by the end of this, every single council person will be sharing this information out with residents in the city, and will themselves get a flu vaccine if they don't already have one. As you all know, the Baltimore City's health department mission is to protect the health, eliminate disparities, and enhance the well-being of everyone in our community through education, coordination, advocacy, and direct service delivery. So we set some aspirational goals this season. In order to have herd immunity for the flu, we need to ensure that 70% of the population of Baltimore City, particularly the most vulnerable, are vaccinated against the flu. We also wanted to make sure that this season we were preparing our healthcare and public health systems for the COVID-19 vaccine interventions. So this year was particularly important around the flu. And I emphasize that we had an aspirational goal because, as you'll see later, our data from previous years has been quite low. So setting a 70% goal was very, very aspirational, we'll see. So you all know the city demographics. I think what I'll highlight here is that we have 124,000 residents that are age 60 years or older, which is about 20% of the population, and about 14,000 residents live in senior housing. So at a minimum, the city is able to cover the households that we have direct access to. So it's just something to keep in mind as we think through the vaccine and the COVID vaccine going forward. We also have about 2,100 residents experiencing homelessness on any given night. And so there's a lot of vulnerability, as you all know, in the city. And with a vulnerable population, you're going to have much more likelihood of disease transmission. Now, the rationale for flu, every year we want to be getting the population vaccinated against the flu. This year, it's more important than ever because we have seen what burden COVID-19 has had, particularly on our Latinx and African American populations. There's been undue burden on those populations. And the idea of the flu vaccine is to make sure that we're preventing a dual or twindemic, they're calling it, where people are suffering from flu and then they also get COVID-19. We also want to make sure that we're protecting our hospitals and not overburdening our healthcare staff. So what is the data in the past? So this is data from 2019 season, 2019 to 2020. You can see that this is from our Immunet database, which we do have a centralized database that registers all of our flu vaccine. That the highest rate we had was under 5-year-olds that had about 50% of our under 5-year-olds vaccinated. And then we had about 34% of our older adults vaccinated last year. So our vaccination rates have been very low in the past. And we wanted to make sure that people understand that these rates really need to be improved upon, and really important for city council members to understand that as well. In terms of flu coverage, what we have, these are the data from last year. We noticed that there was a lot of the large red dots are the areas that were the least vaccinated, and the large green dots are where we had some higher vaccination rates. And this shows the difference between all ages and vaccination coverage for and older, which look largely the same. But you'll see that on the west side of the city has had low vaccination coverage last year. So what was our approach? Our strategy really encompasses, as I said, the entire population, and we depicted it through a pyramid structure. So for low intensity, it doesn't mean that we don't think that these folks need to be vaccinated, but at the bottom, at base of our pyramid, we have a level 1 is what we call it. And these are for any population who we know already has reasonably good access to vaccine, and that would be our pediatric population and populations of people who already have medical providers. And so we are making sure that we're campaigning out to pediatricians and obstetricians. We're making sure that we're getting out to our medical providers and mobilizing them to make sure children are vaccinated. But we're not doing specific clinics for children. At the medium, at level 2, we want to make sure that certain populations are vaccinated. And so we have a specific mobilization and messaging campaign for these folks. And that would include healthcare workers, adults with chronic conditions, underlying conditions like diabetes or asthma. We want to make sure we're targeting pregnant women. And then obviously all of us as city employees should be getting vaccinated to be the role model for the city. And then at our highest intensity, we need to be focused primarily on folks who are most vulnerable to flu and to COVID-19. And so we are most focused in this campaign this year on older adults, particularly those who are African American with underlying conditions, looking at our Latinx community, which had an overall rate of 35% positivity rate of COVID-19, very high disease rate, wanting to make sure we're targeting that population, particularly because there's many uninsured, and then our homeless population. And so when we think about how we develop messages or what we are doing, what we've discovered with flu, as we knew, but maybe I've discovered even more, it's extremely challenging to, in the city in particular, to encourage people to get the flu shot. And part of it is that to actually get that vaccination scheduled, to have the consent, to have the acceptance of the vaccine, there's a lot of behavior change that may need to happen. So we have to be thinking about how we message is really important. So what do people think and feel about the vaccine? What's their perceived risk? I guess you all can see our my notes. Are you guys seeing the slides or the notes section?
Rebecca, that's Nolan. We're seeing the slides and the notes. If you go up to display settings on the top left, you might be able to switch. Yeah, swap presenter view and slideshow.
Does that work? No?
There we go.
Sorry about that, you all. Thank you for sharing me that, Adam. I appreciate it. We also want to be looking at social processes, what providers are recommending, what are the social norms, what is the equity information and sharing rumors. And I will say in the city, there are so many rumors around the flu shot. This year, a lot of residents thinking that the flu shot is the COVID-19 vaccine, a lot of concern about the vaccine. In fact, I've heard anecdotally, and I know providers have been saying that a lot of residents are saying, hey, every other year I've gotten the flu shot, but I'm not going to do it this year. So a lot of issues going on in terms of how we talk to folks about the flu vaccine and making sure that we're correcting myths, because both of those factors are going to affect people's willingness to actually get a vaccine. And then we have to make sure that there's availability of the vaccine, that people who don't have insurance can obtain the vaccine and so forth. And so there are a lot of practical issues in addition to maybe the social determinants and what people are feeling behaviorally around the vaccine in order for a vaccine to take place. And this is particularly, these practical issues become a particular issue during COVID-19, because we don't want a lot of people crowding around in areas at major flu clinics the way we might have in years past. So now, okay, I think. So our goal one is that we want greater than 70% of Baltimore City residents vaccinated against the flu. So what have we done so far? In August, we did mobilize and develop a flu vaccine task force. We, in September, identified different ways to provide safe and effective vaccination approaches, including working with our older adults that I'll talk to you in a door-to-door manner that I'll talk to you about shortly. And then we launched a 3-phase communication campaign that started with the employees of the health department and then continued into the population. Our large focus being in this goal, those vulnerable people. Some of the key goals that we had, and Hyung may want to talk later more about what we did in our senior housing sites, but really make sure in a partnership with Rite Aid that we did site-to-site vaccinations for senior housing sites. So we had already mapped out earlier in the COVID pandemic all of where the senior housing sites were located for a work around a food dissemination campaign, where we were making sure that different senior housing sites had access to meals during the peak of the COVID pandemic. We used the infrastructure that was developed for the food strategy for the flu strategy, and mapped out where we talked with each of the the resident coordinators in these senior housing sites, and asked them how whether their residents needed vaccination, how they wanted to get vaccinated. A huge amount of effort to make sure that anybody living in public housing in a senior housing site had access to the flu vaccine if they needed it. In addition, we spent a lot of time, especially in zip codes 21224, working with Baltimore Medical Systems and others to look at how we can do intensive vaccination campaigns at different sites in our Latinx community. And later on, we've done a number of community clinics in various communities on the West Side. We also needed to develop campaign messaging for pregnant women that we were going to disseminate through all of our Be More for Healthy Baby venues, and dissemination to children through our own vaccine clinics and through pediatricians. We also did an intensive vaccination campaign to homeless encampments. So in addition, as I said, we had two goals. One was to look for a 70% coverage of flu vaccine. And the second goal was preparing our healthcare system for COVID-19 vaccine interventions. And so we have an evaluator who's working with us, the International Vaccine Access Center out of Hopkins and Morgan State University, who are working with us to document, particularly in our senior housing sites, evaluation, any findings that we're having around vaccine hesitancy and qualitative data, but also how well we're able to cover different populations based on our approaches and what changes we need to make so that we have lessons learned once the COVID vaccine is available across our city. One big part of that is ensuring that all of our providers in the city are using the database, the Immunet database, to make sure that we are tracking all of our vaccine and know who's been covered and who isn't. So as I said, what have we done so far? We've developed a task force. We have a website. We have a communications campaign and a surveillance approach. We've held 95 clinics since about mid-September. We've distributed, actually, this is updated, about 900 flu vouchers to residents, and I'll explain those in a minute. We've given about 3,000 vaccines through our venues, and this year we have about 16,000 more shots given at this time than we did last year. But still, we only have 19% of our city covered. And so what kinds of messaging you probably received already through our Public Information Officer, Adam Abadir, is our vaccine campaign for pregnant women, our vaccine campaign for older adults, and our vaccine campaign for vulnerable adults, each saying the flu vaccine is worth it, and ensuring that our website, which is health.baltimorecity.gov/flu, making sure that everybody has access to that website, because on that website, we have every vaccine clinic that's available, and along with every pharmacy that is offering flu shot. So if you just plug in your zip code, you can get the flu vaccine. You can find out where you can access the flu vaccine. In addition to messaging, as I said, we have this website. We have a whole number of clinics that we're offering. We have about a few more coming up in December. We should have two large ones on December 14th and 15th that you should look out for. One will be on the west side of the city and one will be on the east side of the city. So please go to our website, health.baltimorecity.gov/flu, to find out about all of the possible ways in which you can get a flu shot this year. This is what I'd like to draw the council's attention to in particular. This shows where we've had flu vaccine this year by zip code, and this is as of November 27th. You could see that zip code 21209 has the highest coverage, still only at 36%. And where we've been focused a lot in the city through the city health department is 21224, and that vaccination rate is at 27%. Both of those are, and 21212 is also at 27%, but you can see that across the city, we're really, really needing folks to pay attention to the fact that we have a very low flu vaccine rate. We want to pay particular attention to zip codes 21217, 21223, and 21213. These all have vaccination rates, and 21216 and 21229. These are all with vaccination rates that are 16% or lower. If we want to have a conversation about where we can offer clinics, we would love to have that conversation and just think through what's the best way to get messaging out to people. Why is it that these areas of the city are having such trouble getting vaccinated? What can we be doing differently? How might we be working in better partnership to ensure that we raise these rates up? We really want to thank our partners. We have a lot of partners working on this flu vaccine campaign. We have Morgan State, the International Vaccine Access Center at Hopkins. Coppin State University has been offering and administering vaccine for us. Johns Hopkins Center for Communication Programs. We have multiple pharmacies, including Rite Aid, Walgreens, ShopRite, CVS. We have Healthcare Access Maryland, various radio stations. We have texting folks supporting us called Public Results. We've been working with Uber, and that will a partnership that will just start up, who's going to be offering free rides for people to get their vaccines. We have faith-based partners who we've been really, really grateful for their support: city hospitals, the Commission on Aging, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, senior housing sites, assisted living facilities. We have a whole lot of partners, and still we're struggling to get these vaccination rates up. We should really be paying attention to this, because if we're having this trouble with flu, this may have some foreboding for what's going to be happening with COVID. And obviously, we need to be getting to a level of 70% coverage to really have herd immunity around these diseases. So if we could think through, what can we do to mobilize our population around this, that would be excellent. One thing that we want to make sure you understand, as I said, we've shared 900 vouchers so far with the city. So what we have available for people, if you have a friend or a family member who doesn't have health insurance and you live in Baltimore City, you can text 443-990-0579 and you can receive a flu shot vaccine voucher that will be redeemed at a local pharmacy. So that's 443-990-0579, and you will be able to receive a flu vaccine voucher that can be redeemed at a local pharmacy. So those are the slides we had to share, and we are open for questions, or I would ask Hyung or Dr. O'Dowd if they want to share anything further around flu vaccine. Nolan or Hyung?
Good morning, everyone. My name is Hyung Tan. I'm the Deputy Commissioner of Aging and Care Services. Thank you to Assistant Commissioner Deneen for spearheading this citywide effort, seasonal flu. The only thing that I will add is that we really, one of the key populations that we're focused on this year are older adults, and this is a newer intervention that we've developed in response to both COVID and the seasonal flu. So this year we are providing door-to-door vaccinations to older adults in senior housing buildings. To date, we've been able to organize, with the help of many partners, particularly Rite Aid Pharmacy, we've been able to organize 81 outreach events and clinics at the door-to-door vaccinations. And we're learning a lot here. We're going to where people are, and there's still, from what Assistant Commissioner Deneen had mentioned, there's still some resistance, even us being there and providing ultimately free flu vaccination, but we're there, we're in the community. We've been able to vaccinate to date a couple hundred, 500 older adults living in senior housing buildings over the last 6 weeks, and we're proud to be able to provide and offer this to the community. But if there's any suggestions and other ideas that the council might have in helping us spread the word, we would really love to hear from each of you.
All right, thank you all for that. I do want to note that we've been joined by Councilmember Slifer, member of the committee, and we have a few others that may join us soon. Thank you for the helpful presentation. And I actually just got materials to distribute to the council. So shout out to your PIO. That was my very first question, was what do I send out to people? The follow-up I had, can you describe outreach efforts at some of the other, I guess, places that people convene? Like what is the relationship with faith institutions, daycare, aftercare, and food distribution sites?
Yep, absolutely. So we've been working with a number of different, we have a task force, and on the task force, we have a number of different faith-based institutions, and we've been working across the city and doing, a lot of our clinics have been at faith-based institutions. So we've held a whole lot of clinics there. With schools, those schools that we have held clinics where there is either a duty center or a community school coordinator, there's a lot of mobilization. And so that has been very helpful. We are going to be working with city schools a little more closely in the next few weeks to just mobilize a little bit more over the December month. Daycare providers, we have through Be More for Healthy Babies disseminated information, but I would say probably have had less conversation with them. And I think that's, those are obviously providers where we could at least find parents and extended family members. Head Start has been a very strong partner of ours, but maybe the wider private network of daycare providers we could tap into a little bit more. We've done a fair amount of canvassing on the streets. That hasn't proved to really mobilize a lot of people. We are going to be going into methadone clinics coming up over the next month. We're trying to partner a little bit more with our substance use providers to make sure that we're getting to those populations. And a lot of our campaign, we're going to be doing radio advertisement. Adam can speak a little bit more to that, but we've started to do radio advertisement on Morgan State's radio and Urban One.
Okay, thank you. And I would say on the business outreach front, with the BDC in particular, could be a good partner for you. If you haven't worked with them already, they were pretty helpful in the beginning of the pandemic at helping us identify businesses to get out materials in and make sure that they were doing surveys and that kind of thing. So they may also have contact info. I don't want to sign them up, but they did a lot of outreach at the beginning of the pandemic which could be helpful for you with the daycares and other business places that may not already be partners. Are there other questions from the committee on this?
I would just emphasize we really are concerned about these neighborhoods that have 10% coverage, and I really would love a conversation about that, because that is not for lack of talking with folks, and I don't know if the council folk can help us in those areas a little bit more aggressively, because those are areas that are vulnerable to disease. There's a lot of other issues happening in those neighborhoods that are that make people very vulnerable as it is.
Yeah, I agree, I'd offer up a offline conversation about target areas in across the city, and I would say outreach to individual council members where there may be particular neighborhoods that do need a little bit more attention. I think folks would be very much willing to do some more outreach there alongside staff. I know when we've done a few outreach events with the city delegation as well as council members during the beginning of the pandemic with COVID-19 materials. I'm certain a number of folks would be willing to do the exact same thing for this. So we have the maps. If the data you showed was by zip code, but if there are particular neighborhoods that you could drill down to, I think that would be helpful for us.
Yeah, we can get down to census tract for sure. Yep.
Yeah, that would be helpful. I know for me, I mean, the zip code data is helpful, but my district is mostly 21229. I have others, like 2 other zip codes, but the largest portion is that. But if I could say, look, today on Fridays we're going out in Irvington or somewhere else to push out materials, that'd be helpful. Are you all? How much flexibility is there in mobile clinics? And that kind of thing, as far as if you were to reach out to council members and as a part of a pop-up, is that how much lead time would that kind of thing take? That kind of thing. I know these clinics aren't easy to run, especially during the pandemic. But just throwing it out there.
So if we can get volume of 25 or greater, our pharmacy partners are usually Rite Aid is willing to go out for 25 people per hour. So for a larger population, we can pop up very quickly with a pharmacy. For smaller groups, we have a vaccine ourselves and can also set up clinics. We are working with Coppin State, and they're very eager to have their nursing students come out with us. And so we can definitely set up clinics. And so we're ready to do that. Maybe sometimes it might take 2 or 3 days to get them set up, but honestly, if somebody wanted us to do something quicker, I think we can figure out a way to do it, but we're very willing to work with folks to set up pop-up clinics.
Yeah, let's I guess figure out what options make the most sense in target areas. The other thing that we did early on this year was door-to-door leafleting and lid drops in hotspots. I think that could also help as well, if it was like clinic information or just the numbers to call, that kind of thing. Just to raise awareness.
Yeah.
Yeah, just to raise people's awareness around it. I think the other thing that, and maybe you all, I'm sure you all have talked about this, but I think there's also just a general distrust with vaccines themselves, especially with the politicization of COVID and everything that's been sort of the conversations on the national level around that particular vaccine. How are you all combating that and I guess the misinformation that's out there around the safety of the flu vaccine in particular?
I mean, it's a really good, that's why we really started with the theory of change, because we understand that this is a very complicated issue around vaccine in general. And flu vaccine is one of those that we're discovering has a lot of misconceptions. So number one is, when we created our messaging, we spent a lot of time in discussions with community members, older adults, pregnant women, really talking about what's going to be a compelling message for you. So our campaign is really designed specifically for people and what they told us about in terms of how to best share this information. But having said that, we have a whole frequently asked questions fact sheet that goes behind, that we can, if we did a door-to-door dissemination of clinics, we could also, on the back of that, we can have frequently asked questions that address different misconceptions. We've been holding some town halls, although we would love to hold more, where people can sign up to just learn more about the flu vaccine. Trusted leaders is probably the most important avenue. So through the faith-based institutions, through pediatricians and physicians, through you all, making sure that the messages are coming from all leadership around the importance of the vaccine. We, as I said in the presentation, that we are definitely hearing a lot of concern and mix up between the COVID vaccine and the flu vaccine. And people thinking that it's the flu, the flu vaccine is the COVID vaccine and things like that. And I have a feeling, because the COVID vaccine is coming out sooner than later, there may be some further confusion. So I think all the more reason that the council people need to be really well informed and understand themselves some of the misconceptions. We have a whole list of them. We can send them out, send out what we've been hearing, and that might be helpful for the council folk to have that at their fingertips and continue to get that out to community members.
Agreed. Okay. Well, look, let's keep talking on that. I'll send out the materials that have been provided so far to the council, and then encourage them to use their platforms to disseminate it out. And then let's have some offline conversations around some targeted outreach as well. And I'm sure those council members would be willing to share those influential folks, people who need that message or who can gather people who have a large audience. So let's work together on this. I think it's incredibly important.
Thank you so much.
I don't want to dominate all the questions. Are there anything else from the committee members? Okay, seeing none. Looks like
everything I was going to ask got covered in the presentation.
Yeah, I was going to say a lot of what I had written down did too. Okay. Unless if you all are done with your presentation, we'll go to public testimony if there is any. All right, so I'll read the instructions. For those who are signed in using a computer, please use the raise hand function to indicate you wish to testify, and we'll start with you. We'll go through all of the attendees who also, I don't think anyone's called in, but if they have, you will hear a beep, 2 beeps when you're unmuted. If you wish to testify, please state your name at the beginning of your testimony. If the caller does not want to provide testimony, then simply say that you don't want to provide testimony. And with that, I'm going to hand it to Marguerite. I don't see any hands raised, but are there any callers, Marguerite?
No, Mr. Chair, none.
Okay. Well, with that, we are going to adjourn. I'm looking forward to working with all of you on this very difficult flu season, probably more than any of us have seen. And so I think we all have our next steps, things that we want to work on to get the word out and encourage people to get vaccinated. And I'll be working with my council colleagues to encourage them to get vaccinated and get the word out. But thank you.
Sorry, I just wanted to let you know that if you do want to get involved in some of our efforts, just please reach out to me, and I'm happy to connect you to our various staff at the health department.
Okay. Absolutely.
Same goes for everyone else on council as well.
Okay. Absolutely. We'll be reaching out. All right. There's no other business before the committee, so we are now adjourned. Thank you.
Thank you.